Well, I first came to Johns Hopkins All Children's Hospital 30 years ago. Back in 1986, I was a medical student doing my pediatrics rotation here. My class at the University of South Florida College of Medicine was the first class of medical students who had the opportunity to do their pediatric rotation here, so that was my first introduction to this place. But then I came back and completed my pediatric residency in 1990, and then I've been in my current position as an attending physician since 1993, so that's been 23 years. When I try to consider what I'm most proud of as a physician, I think of a couple of things. One thing that I'm really proud of is when I see my former students or residents go out and be great physicians in the care of children. And especially when some of them come back and they're just amazing physicians who become my teachers. Another thing that I'm proud of that was on a slightly more personal note, but relates to use of my medical skills, was a few years ago when my own son developed acute appendicitis. And based on his symptoms and examining him, I was able to diagnose his condition very early on before it turned into a bad situation. And that was such a relief, a gratifying relief, that I was able to do that in my own family. Just before coming to this interview, I was running a little late because I was seeing a patient, and it's a patient I'd been following for several years. And she's had a lot of stuff going on. But at the end of the visit, as I'm trying to rush out, she reaches over and gives me a hug. And that kind of resets everything. When I'm concerned about being late for an appointment, I think, this is why I do it, in the hope that I might try to improve the lives of some of my patients and their families.